All right, welcome back to Live at 9 with Halloween parties and festivals happening all over our community. We have to be mindful of how to protect and best protect ourselves to help prevent from respiratory tract infections or any other health-related illnesses. Today, we have Dr. Quinn with us to discuss some preventative measures while still having fun. Good morning, Dr. Quinn.
Good morning.
So how important is it that we're up to date on our vaccines before we head out to all of these fun fall events?
Well, the deal is, I actually called the Mississippi State Department of Health on yesterday, and they advised that everyone get the flu and COVID at the minimum. And if you have not already done so, go ahead and do it now as soon as possible, because it takes about 2 weeks to develop the benefits from the vaccines, including your antibodies in your bloodstream. But there are 3 things I want to talk about in regard to the vaccines. Number one, if you get vaccinated, you have a much lower probability of contracting the flu or COVID. Number 2, if you get vaccinated, you might still get it, but if you have symptoms, they're typically much less severe and you get better much more quickly.
Right.
Number 3, if you get vaccinated, you have less of a chance of continuing the infection and serving as a carrier. Maybe on Sunday you go visit your grandma, give her a kiss, but she's not as strong as you are as far as your immunity, and you could cause her a lot of pain and suffering, and we all love grandma.
Absolutely, Dr. Quinn. Those are just some crucial points there of reasons to get vaccinated. If you haven't already, do so now so they can start working and start really being effective before you head out to those parties and even with more holidays in our near future. But in addition to vaccines, what other preventative measures can we take in order to keep ourselves and our families healthy?
Well, we want to consider wearing masks, especially if we have chronic medical conditions and we're considered compromised as far as our immune system. And that's an individual thing that you might want to discuss with your provider if you have some type of, like as I said, chronic medical conditions, or you're on some type of immunomodulators. These are medications that make it so your immune system is not as strong. But also note that it's getting colder. As I said, this morning was the first time that I've had my heater on, and as it gets colder, we'll start congregating more indoors, which is more of an opportunity for these infections to occur, because we're all just ha 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 right in front of each other. and we want to practice hygiene, like if you sneeze, sneeze into your arm. But these are some things that we can do to help us stay more safe during these fun times as we celebrate with our family and friends.
Absolutely, Dr. Quinn. So like you said, a mask is a good idea if you're immunocompromised. Maybe just talking with your healthcare provider that knows exactly your situation on how you can stay safe. Of course, being a little bit more cautious around those that are more vulnerable, so our elderly and our children, especially our infants as well. Are there any tips, though, you can give us when it comes to consuming food and beverages at large gatherings?
Well, in regard to the food, I mean, I go to a lot of events with my beautiful wife, and sometimes I see people walking around saying, man, this is a good plate. This plate is good. Hey, have a little bit. And then they'll take the plate and cut it with the same fork, and man, that was really good.
Right.
And then you give it back to the person. That's not a good idea right now, because people are starting to get sick. The clinic is packed with people with upper respiratory tract infections, and we talked about being a carrier, taking it back to your home, giving grandma a kiss or giving your new baby a kiss. So let's try not to share food. Maybe say, oh, this is so good. And then you say, go over there and get you a plate. Direct them to the table so they won't use your plate. And then also we talked about, like, if you sneeze, you want to cover up. And then if you shaking hands, like, you're going to shake hands, and always, wash your hands frequently, and try not to put your hands around your mouth or your nose, because you could shake someone's hand and then you can contract the infection to yourself just like that. But these things are just really good tips. And I can't leave without saying, when you go to these events, have fun, dance, and whatever. But when you get ready to go home, make sure that if you have any impairment due to any alcoholic beverages or anything else, don't drive.
Right.
Also, don't ride in a car with somebody that might be impaired. You can not only harm yourself, but you can harm someone else, and that's something we don't want.